Hi everyone, welcome to the YouTube channel fmge Dr. Aman. In this video, I'm going to talk about the prostate topic from the urology surgery, and this is one of the most favorite topic. Even I would say that if you have to just read the one topic and go to the exam from the urology section, you have to read about the prostate because this is very frequently asked in FMG examination and in any examination, and this is quite even easy, not too much too much kind of concepts in this. So let's start about the prostate chapter. When we start with the prostate, first we must know the zones of prostate. We have three zones, like transitional zone, we have the peripheral zone and the central zone, and there are some significance of this zone. So you have to know, like, in which zone there is the benign prostatic hyperplasia takes place, in which zone the prostatic cancer takes place most of frequently. So you have to know about the zones and their significance. After knowing this prostate, uh, you have to know about that what is the prostatitis. Okay, what is the acute prostatitis, what is the chronic prostatitis, and you must be able to differentiate how would you differentiate the acute from the chronic. And while reading the prostatitis, you have to focus on the digital rectal examination, because on this basis of that you would be able to differentiate between them. Okay, and on the urine examination you have to look at that. You have to know about the Myers test. Okay, Myers test, or you can say that is also known as three tube test. You have to know, like, in the first tube, which part of urine you will collect. I mean, from which part of the urinary system that urine is coming out, and you are collecting that. Okay, so you have to know about the Myers test or three tube test, which is done in the chronic prostatitis. Okay, after that, after knowing the prostatitis, you have to know about the topic, that is proper topic, benign prostatic hyperplasia, and this is the 90% time asked questions from the prostate. So read about the benign prostatic hyperplasia in details. There is nothing to say that you have to know only this and only that. You have to know each and everything, from the digital rectal examination to all kind of examination, all biochemical investigation, like we do the PSA, prostate specific antigen test. You have to even know about that. You have to know about the uroflowmetry is very important. Okay, so you have to know about that as well. So, and their treatment, if you talk about the treatment part of benign prostatic hyperplasia, you have to know about the TURP, transurethral resection of prostate. So read about the TURP. And there is one significant, there is one side effect of TURP is TURP syndrome. Okay, or the toxicity of the media what we use during the surgery of prostate. So read about the TURP and TURP syndrome both. They both has been asked so many times. So read about that in BPH. Okay, so I think you covered the 70% of prostate while covering this topic. And after that, you have to know about the prostate cancer. Prostate, yes, and one more topic, that is the prostatic stones. You have to know as well. So many times they give, whatever I am telling you, that the zones of prostate, you have to know even the diagram, because these days they just give the diagram and they will ask you which zone is this. And maybe they will give you like, this is the BPH, and which of the following zone is involved. The BPH like ABC, they will mark and they will ask. So read about, I mean, they look at the image as well. And they ask the prostate stone. Okay, so they give you the photo of corpora amyloacea, okay, which is the precursor of prostatic stone. So look at that image as well. They will give you the sometime image as well. So look at that as well. Okay, and yeah, if talk about the prostatic cancer, you do not need to go to the very depth. You have to know in the prostatic cancer the Gleason score. Gleason score is very important even you will study in your pathology and in surgery, anywhere. So you have to know about the Gleason score. Then you have to know, like, which lymph node is involved in the prostatic cancer. Okay, and how the cancer transmit, how the cancer metastasize from the prostate. So you have to know about that as well. And you have to know which part of vertebra is involved in the prostatic cancer, okay, through which vein they transmit, and that changes is osteoblastic type or osteoclastic type. So you have to know about that in the prostate. The treatment part of prostate is not frequently asked from the fmg, but I think this much is enough from the prostate cancer. Okay, so read about that all topics, and solve your pyq, and I think this will be the enough for your what to say, the fmg, um, I mean the fmg, to solve the fmg questions. So thank you, bye bye.